How to get health insurance before Medicare. This is probably the number one issue people have. It's sad, man. Look, I'm dealing with this myself. I get it. And we're going to go into this here in a second. But, man, there are options. There are options. And so I did a blog post about this morning. I sent an email link to my subscribers on my just quote newsletter, unquote. I don't really call it a newsletter. And I put the links on my YouTube channel for the blog post, and I put the links on my Rumble channel and on my Locals channel. Because this is it, man. I get this question probably more than anything. I guess I get the question about investing most, but this is number two. So I just share with you my, look, I get it. We're dealing with that. My wife and I and my 4 kids. So what you do is you go to heritagewealthplanning.com, all right, and it'll take you to my homepage here. If we click on this guy right here, is it going to take us there? Hold on. All right. So you go to heritagewealthplanning.com, and you'll see the pretty Peaks Island shore from where I was from. And you scroll down, my last 3 blog posts are here. I do probably 1 a week or so. Yeah, so 3 in the last 3 weeks. So basically 1 a week. And we're going to click on health insurance before Medicare. All right, so let's see what we come up with. And for me, it's a pretty long blog post. It's 1,100 words. For a lot of bloggers, that's not. But man, I'm not a blogging kind of guy necessarily. And so for me, 1,100 words is a lot. Usually my blog's about 300 to 500 words. Anyway, so right here, my wife is so stressed at her job, but she can't quit because of health insurance. It's actually an email I received, my friends. This is my man. I'm not going to say his name, but he sent this to me. And we look at that stuff, you're like, dude, you're in such good shape. And the wife is 63 years old. I'm like, she's so stressed. All right, so let's just read this. If I had a nickel every time I was told something like this, I'd have 1,000,000 nickels. Get it. Look, as much as I don't like Obama as president, and I certainly don't like Nancy Pelosi as speaker in 2006 to 2010 or now, the fact is that Obamacare is the law of the land. Obamacare is actually passed by legislation through Congress and signed by President Obama. And we held him accountable in 2010. In fact, 2009, Scott Brown took out Marsha Coakley was the Attorney General. That was a huge wave of a red wave that led into 2010. But of course, Republicans did nothing after that. All right, so this is the way politics is supposed to be. Not a dictate by some unelected, unaccountable public health official. So Obamacare is the landscape we're operating under. You can yell at the clouds all you want, but let's deal in reality. So let me paint a picture of a couple I was dealing with the other day. This is a true story, man. They want to move back to their native state. We'll call it Montana because it's rural. And there's a reason I'm painting this picture for being a rural state. They're only 58 years old, and they're going to have to go on the exchange or something else before they're 65. They could go to the Medicare route, which co-insurance, which I like, faith-based co-insurance plans. I was on Medicare for a while. The problem is when it comes to pre-existing conditions. And so they had budgeted $24,000 a year for health costs until Medicare kicked in. They had also budgeted $6,000 a month for discretionary expenses and another $2,000 a month for a mortgage. So basically they're saying we're going to spend $10,000 a month. And when I ran the numbers, they're only at 7% probability. I was like, ugh, that doesn't look good. And I was nervous, man. I'm telling you, whenever I talk to somebody, I don't have to talk to too many people. I say, you got to tighten up. But I was like, I had a sneaky suspicion something was wrong. Though. Before I talked to them, I was running their numbers before we spoke. And I was like, something doesn't seem right. Well, it turns out that that $6,000 a month was their discretionary. It wasn't just discretionary. That was all in. So basically, they need $6,000 a month for everything. All right, and I said, gotcha. So we're double dipping in terms of $6,000 a month, including the mortgage, $6,000 a month, including the healthcare cost. And again, the healthcare cost of that $6,000 was $2,000 a month. So they're pretty frugal, actually. Anyway, so let's assume these folks will move to Billings, Montana, a smaller city, about 100,000 or so, and it's the largest in the state of Montana. But there are no major universities in Billings. Yes, satellite campuses, but that's it. And that's a pretty important thing because everyone's like, oh, no major universities, the healthcare provider network will be limited. So we have a small town in a very rural state with no major universities. Not the best environment for insurance companies to want to do business, and really not a great environment for providers to set up shop either. Yet, and this is where things get real interesting. We go to healthcare.gov, and I'm going to show you right here, healthcare.gov, all right? And we type in their zip code. Let's go back to my blog here. 59101, healthcare.gov. We're going to type in 59101, and we're going to choose Yellowstone County. All right, this is exactly what I said in my blog post. All right, so then we're going to tell us about you and your household. We're going to hit that. We're going to skip this plan ID because we don't have we're not in the marketplace right now. We'll say skip. We're going to say just me. We'll say me for now. We're married. Hit continue. And we won't declaim any dependents, and we'll hit continue. And we'll say I'm 58. Again, this is my client. He's male. He's not pregnant. He's not a tobacco user. He's not a legal parent or guardian of anyone under 19. He's not eligible through coverage through job, Medicare, Medicaid, or CHIP. So none of these. We don't know if he's pregnant, because men can get pregnant today. So you don't know. So I had to ask him, are you pregnant? Because I don't want to be perceived as discriminatory. All right, so Joe, female, she's none of this either, not pregnant. Anyway, so we're 58 each, husband and wife, 58. We're going to hit confirm. Now we're going to say their income's going to be about $60,000 a year. And we hit continue. So we're going to get $1,380 a month in healthcare premium credits. All right, so if we go back to my blog post, I show you this exact what I just did. All right, and we're going to go estimated $1,380 a month premium tax credit is the amount you can use to lower your monthly premiums each month. It's not the premium itself, it's just the amount you'll use to lower it. All right, so let's go back to healthcare.gov, and we're going to hit view plans. And we're just going to skip all this. We're going to hit next. We're going to view them all, and we're going to see all plans. And what we're going to do here is I want to filter these out because I like to look at PPOs. And we're going to hit that, apply filters. And we're going to see you have estimated monthly premium for a plus individual bronze HSA plan. It doesn't cost anything. You're literally no premium at all. Now you have out-of-pocket expenses and deductibles are high. And you don't cover dental. But I mean, my goodness, man, there's no, look, and I don't know who's in network. I have no idea. You'd have to do that. But I was like, look, no premium? And all right, so you have an out-of-pocket deduct. This is exactly what we want. We want low premiums and high out-of-pocket in terms of high deductibles. That way you don't use a doc because you have a hangnail. We don't want to use health insurance, the equivalent of using your file insurance claim to get your oil change. We don't. So it's a good thing to have a high deductible plan. I'm telling you, it just keeps the premiums low for a lot of people who don't use health coverage that much because they're not in bad shape. This is a wonderful plan. Now, who's involved? I have no idea who the providers are. None whatsoever. It could be the crappiest plan ever. I don't know. But remember, health insurance doesn't mean crap. Health providers are what runs everything. If you can't get good providers, I don't care what kind of health insurance you have. I don't know anything about Plus and Bronze. I don't know anything about Connect Bronze. So let's keep going down. Navigator Bronze, I don't know anything about it. Connect, I don't know who these guys are. So we're going to keep going down and see if we see anything. Here's Blue Cross right here. Preferred Bronze. Preferred Bronze. $105 a month is what it costs. Again, out of pocket, deductible, same thing, pretty high. We'll click on plan details. Estimated monthly premiums, including the tax credit, deductible is $8,700 for the individual. Okay, and $1,700 for family. Out of pocket max, $1,700. Even that's all you're going to pay total. Estimated yearly cost. I think you got to go in there and say expect low use right here, and we'll set next person. We'll expect low use for her, and I guess they can give you. This is I tell you, man. And they're going to give you. They say estimated total year cost is $2,600. All right, so let's go to edit yearly cost. We'll say expected high use. Next person, expected high use, and we'll see what they say here. They say you're going to cost the extent of your total out-of-pocket maximum. So you're going to pay $105 a month for your deductible for your premium, and then you're going to pay $17,400 out-of-pocket max. Medical providers in network. And you can enter the name of your doctor and all that. And I don't know if you can just hit search. It will give you all the rest. I guess not. I guess you got to go back. So anyway, I don't know who's involved in these plans. I don't know. But it's pretty sweet. I'm not going to lie to you. Anyway, so you see that, man. And then you can go all the way down to next. So this is what we've always wanted. The free market is we want high deductible plans, low premiums, the voucher system. It's just the way to go. That means you are in charge of your own health insurance. If you use a doctor a lot, for whatever reason, you don't want a high deductible plan. You want a low deductible, but you're going to have to pay a higher monthly premium. So the most expensive one was this guy right here, Blue Preferred Gold PPO. So we'll click on this. It doesn't include dental again. $1,500 deductible. That's not so bad with a $17,400 out-of-pocket premium. Estimated monthly cost right there is $27,000. I have no idea what you get in this that you don't in the other one. I don't know. But let's just say edit yearly cost right there. All right, so edit yearly cost is $27,000 if you use a doctor a lot. We're going to say expected low cost. expect low use. I mean, low use, and we'll see what they say. It's still going to be $10,000 a year. So, I mean, look, drugs covered, not covered. You know, I'm on Lexapro. Let's see if we got Lexapro. I don't know if it's going to be on here. Let's see. I like Lexapro. Oh my goodness! So you do like Big Pharma? Yeah, man. We got that ad. I don't know what I take, so we'll say 5. I don't take much. Continue. And it okay. So you can do that before you say lowest premium. You can put your Lexapro before you actually choose a plan. All right, there you go. So we got preferred blue silver, $700 a month. I'd have Lexapro on there, cost me $10,000 a year. It ain't cheap, but I mean it's doable. Lexapro 5 grams. So you have to put it all in there. Anyways, keep going back to my blog. All right, so we already did all this. We say we're going to save quite a bit of money, and if you're taking a prescription drugs, you want to make sure it's in there. And I'm sure there's generic things they offer here. Let's go. Can I go back to plans? So back to plans that give you Lexapro. What was deductible? Let's see. Estimate yearly cost. Add more filters. Lexapro generic cover. There you go. So generic. So if it wasn't 50% co-insurance, if I wasn't taking Lexapro, then I wouldn't have to pay all that money. Now, how do you get prescription drugs? I don't know. I don't know how it works, man. How do you get prescription drugs if you don't get through health insurance? I don't know if you pay out of pocket. I don't know how that works. But it's something. I mean, look, this is what you got to look at. But it's there. It's there for you to look at. All right. So then it went on for me, your old buddy Josh. I say, do you think only people in Billings, Montana are that lucky to have all those options? I highly doubt it. Let's say you live in Atlanta suburbs like I do, and you have 4 kids like me. And then we got right here, I'm putting up $60,000 a year income. I'm saying, whoa, I don't make enough. 3 of my kids are going to go on Medicaid or Children's Health Insurance Program, and I don't really want that. Trust me. If you can avoid Medicaid, you should. Medicaid is it's redhead stepchild health insurance. No other way around that. And here's me and my 2 adults here, my wife and Maddie. So we're on Obamacare, but my other kids are on CHIP, and that's not what I'm looking for. Here, notice my. Let's see. Why did I qualify? Because I only made $60,000. So $60,000 with a family of 6 puts us pretty low income. So what I want to do is I said I'm going to have to raise my income to $100,000. Look, I'm just using an example. If I had $100,000 of income and I was on Medicare and I was on Obamacare, all of us would qualify for Obamacare, and then we get premium tax credits of $1,764 a month. And there are 142 plans available. Now they're all HMOs. All right, well that stinks. My wife doesn't like HMOs, but that's not the end of the conversation. Why? Because you align yourself with a concierge primary care doctor with all the money saved because of premium credits. I just signed up for one with Partner MD. I'm going to go see her on Thursday. The concierge doctor for just me costs about $2,000 a year. I think it's about $5,000 if I put all my family in there, which you probably will. I want to see how it shakes out for me. I haven't met her. I mean, I've talked to her, but I haven't met her in person yet. So on Thursday, I'll let you know. The point being is there's so many opportunities for health coverage without solely relying on your employer. Why are you not at least taking advantage of this? Especially if your work is literally killing you. We haven't talked about Medicare and the other faith-based co-insurance plans that are out there. So let me just tell you how many people actually get physically well once they quit their crappy old jobs. I hear this all the time, my friends. They lose weight, blood pressure drops, they sleep better, they eat better. It's almost like work is making you sick. And that's why you stay at work, because your work provides the insurance to deal with the sickness that work is causing. It's catch-22. I can't leave work because I'm sick. Well, it's causing you to be sick. It's work. It's kind of like Big Pharma. You need pills to deal with the pills they've given you before to deal with the issues that are related to your work. Nuts. You really need to find the source of your discontent. Once the target has been isolated, see how you can eliminate it from your life. But for heaven's sake, stop being a pawn and just taking the path of least resistance. It does require some effort. Getting up every day to go to a job you hate is an effort. You're already doing the effort. To quote our esteemed president, come on, man. And I already got a couple of people that unsubscribe because they don't like my politics. That's fine. Come on, man. Anyway, just start looking around. I'll put a link in the show notes for the blog post so you have all the links. But, man, if your job is killing you, making you fat, angry, heavy, you're not sleeping, your blood pressure's through the roof, I don't get it. I quit my crap old job with a fat mortgage, A wife and 4 kids, no other income to start this. It didn't happen overnight, but like my man Miles Beckler says, we overestimate what we can accomplish in a year, but we underestimate what we can accomplish in 3 to 5. Completely agree. First year is going to be tough, grant you. You might have to go on Medicaid the first year. Okay, it's a safety net. Try not to use a doctor. Second and third, you should start seeing some momentum. By fourth and fifth, as I am here today, you're like, man, things are pretty good. I don't know if that'll continue. I have no idea. But I know I'm a hell of a lot better now than I was in 2017 when I was working my crappy little job. But I didn't stay there because like I gotta have health insurance. I said, we gotta take the risk. You only get one life. Love to hear your thoughts. All right, we'll see you.